Hi everyone, thank you for joining our virtual dental shadower session. There will be no quiz for today's session. All right, so let's get started. We're very fortunate to have dental hygienist Harishini with us today. I'm handing the mic to you. Please feel free to start whenever.
Hi everyone, my name is Harishini and I'm really glad that Virtual Dental Shadowers has chosen me today to speak, and I'm very excited to speak today. So my presentation is going to be about becoming a dental hygienist and my journey so far. So some background information about myself. My name is Harishini Ramesha. My role right now currently is as a dental hygiene professor at a private institution in Ontario. And I'm also a clinician and I work at a general dental practice. My educational background. So I started off doing my bachelor's of science. I majored in human biology and did a double minor in English and physiology at the University of Toronto. And then I went on to pursue my dental hygiene degree advanced diploma at George Brown College. And then I still wanted to do more schooling. So I went on and did my master's of higher education at the University of Toronto in health professional education. That program is unfortunately not available anymore, but they do have a higher education program with other specialties. So currently I'm working at the Canadian Academy of Dental Hygiene and also as general dental practice. And my Instagram handle is @oralsystemic. I started this Instagram page as an education awareness page during January this year. And I just talk about things like the oral systemic link and some fun videos and dental tips and tricks. So if you want, you can follow my page. So some study tips and advice on staying motivated. As an educator and a student previously myself, I'm always considering myself a student as well as an educator. The first thing is being organized. So things like having a calendar, even if it's not on technology, like on a computer or on your phone, I like to kind of have things on paper, or even like the calendars that you put on your the whiteboard calendars. Anything that you can see at a glance will help you see your entire week or month, whichever way you like to organize yourself, how many tests you have coming up, how many quizzes, how many assignments, which courses, to-do lists. So prioritizing what needs to be done first versus, prioritizing things that are due later on, keeping adequate notes and always taking notes while you're a teacher is lecturing you, and then reviewing those notes afterwards will all help you keep on top of your courses and your assignments, and you won't feel so much pressure at the end to study everything, because there is a lot of course load in the dental hygiene program as well as dental programs and other healthcare professionals. Prioritizing tests and assignment by weight percentage, that's a really important one. So if you have a test, for example, or an assignment that's worth 20 to 30% of your grade versus a quiz that's only worth 5%, you want to spend a little bit more time preparing for the test that's worth more, even if it's a little bit later on in the week or the month. And also judging and self-reflecting on your knowledge base. So if you're really strong in one subject and a little bit weaker in the other ones, you don't want to keep studying the same subject you have a higher knowledge level in. You want to spend more time in the areas that you're weaker in, so then you can excel in that course. Also, what really helps is not overstudying. So I know that sounds kind of, taboo, but 45-minute sessions with 15-minute breaks works really, really well. So don't overwhelm yourself. Don't, wake up on a Saturday morning and say, okay, I'm going to study all day today and it's going to be a great productive day, because that usually never happens. You're studying for an hour, then you go on Netflix and you watch a show for 2 hours, or a movie, and then you go back to studying, maybe study for another 20 minutes, and then you take a break, and then that break ends up being really, really long, right? So having a timer, like a phone or like any type of timer, put an alarm for 45 minutes, study for that 45 minutes focusing, don't have any distractions around you. And then once that timer goes off, you're mandatory, take a 15-minute break, right? So take that 15-minute break and use it to just relax. Don't flip through notes or don't start studying during that 15-minute break. So do something for 15 minutes that you enjoy, have a cup of coffee or tea, and watch a show or something like that. And then once that 15 minutes is up, you have to go back to studying for 45 minutes. So doing that will help train your mind into focusing for short bursts of time and then relaxing your mind. So try that, and hopefully that works for you. And the next thing, advice or tip that I have is to celebrate your successes and celebrate your failures. So failing does not mean it's the end of the world. You learn when you succeed, but you also learn a lot when you fail. So if you end up, not being successful in a test or an assignment or even in a program or even in a course, it doesn't mean that you are a failure. You just learned what not to do. So next time you can work on what you should do to become successful. So failure is the first attempt in learning. Do not take it as something to demotivate you or, make you not chase your dreams. So it's not end of the world. There is another day. Tomorrow is always a new day to start again. And you can always do something differently the next time in order to become successful in whatever you're pursuing. Okay, so choosing specialities. So I've been interested in all aspects of the dental field or dental hygiene. However, academia was kind of my passion. So when I was in school, I always enjoyed learning. I always enjoyed learning new things. I always saw my instructors and my teachers, and I was like, wow, I want to be one of that. I want to be that one day. And one of my professors was really inspiring to me. And she is the one who encouraged me to pursue further. And here I am today, talking to you and teaching my students as well. And without her encouragement, I wouldn't be here, today as well. So I'm very grateful for any instructors, anyone that's been a motivating factor for yourself to chase your dreams and keep going. I've considered things like orthodontics, restorative dental hygiene, and also independent practice. So I'll talk more about kind of the options for dental hygienists in Ontario in coming slides. I haven't pursued any of those specialties yet, but I'm in the works of, I'm trying to learn more things. I've had troubles, during school, just like every other student, things like doing impressions, model building, dental materials lab, where it was not my strong suit. It would always take me a few attempts to get it right. But in every program, in every course, you're not going to be 100% perfect or, like every aspect of that field. And you have to kind of go the avenue that best suits you. So if you like children, you can consider pediatrics. If you like, orthodontics, you can do that. And there's other options as well. So I would also like to see more oral surgery. There's not too much exposure in college and universities for oral surgery. There's limited hospital placements. So these are some things that I would like to see more in the dental field and dental hygiene field. So there's quite a bit of specialties that we can do as dental hygienists. Okay, so what a typical day is like for me, it changes drastically actually. And before COVID or the pandemic hit, it was quite different. However, now there's a whole new normal, right? So with working in an educational institution, there are several protocols that we need to follow, especially also with clinical practice. So as frontline workers, we have to make sure that we are safe, and we also keep our clients safe as well. So things like COVID screenings before the people come inside the facility. So in the morning or the night before, we would do a COVID screening test online to say that, that we don't have any symptoms. And then once we go into the facility, we also have to do another COVID screening quiz or questionnaire. They take our temperature, and we're always wearing a mask in any part of the facility. And if we're actually dealing with clients, then we're in full PPE. So full PPE meaning face shield, goggles or glasses, mask, N95 mask if there's aerosol generating procedures, gown, gloves, and if there's also head bouffants and shoe bouffants if you need so in the AGP rooms. And we are also limiting some procedures in the facility. So there's more likely to do non-AGP or non-aerosol generating procedures, and there's fewer rooms for AGP as well. The facility also had been manipulated, so there's closed doors and closed rooms, and that wasn't there before as well. Now we do online lectures, so there's no more live lectures. And there's hybrid preclinical sessions. So what that means is that the preclinical sessions for the first year dental hygiene students starts off online for some things that we don't really need to be in person for. And then we go into little groups, smaller groups in person, and the sessions are divided into morning sessions and afternoon sessions. And depending on whichever group you're in, you'd be going in morning or afternoon, and then it alternates. So it's a little bit different now. Before COVID hit, everything was in person and in the facility. There were no masks being worn, and there was less limitation, but everything's for the good. So it's great that we're still open and running and providing care for everyone. So every day is flexible, every day is a little bit different, which is one of the things I like about the profession. You can kind of make your own hours. You can, you're not, limited to a 9-to-5 job, which is something that I really enjoy. And as an instructor, some days I'm working really long days, like 12-hour days, and then other days I'm working, 4 hours, or, have a full day off to mark and do other clinical stuff, right? So it really is a mix, a nice mix. Okay, so a typical day for a dental hygiene student, especially in the facility that I'm teaching at, so it's a private college. And before COVID, like I said, there were live theory courses or didactic courses and clinics. So during the pandemic, it's online theory courses and clinics, which are limited. So the college that I work at is a 20-month program. And it runs from April to October as one session, and there's October and April intakes, which means that new students come in either in April or in October. So if you're interested in pursuing dental hygiene as a career, there's different avenues that you can take, and I'll be speaking about that shortly as well. So in the facility that I work in level 1, you take that's a typo. You don't take nine didactic courses. I don't know why it's there. Sorry. 9 didactic courses and preclinical practice. In level 2, it's less, not 9 didactic courses and clinical practice. Level 3, there's 5 theory courses and clinical practice. And then level 4, it's community placement. So you get to actually go out in the community and do some community work and get some experience. And then clinical sessions that are much shorter, more like what's going to happen in real life. During the pandemic, there is it's a little bit different because things got a bit pushed back. So sometimes the clinics are limited depending on what kind of treatment you have to provide. The 20 months program might be a little bit extended again if things change during COVID. Some students have been pushed back a little bit during COVID, but everything else stays the same. So it's just the delivery mechanism, but it's roughly around 20 months still. Okay, so the road to becoming a dental hygienist or registered dental hygienist. So the title that you receive is an RDH, or a registered dental hygienist. You can get an advanced diploma or a diploma in Ontario. In other provinces like Alberta and British Columbia and Manitoba, there's dental hygiene bachelor degree programs where you can actually get a bachelor's in dental hygiene. So again, depending on the province that you're in or the province that you want to go to or work in, there's different kind of avenues you can take. So my personal path is that I did my undergrad degree first, then I went to dental hygiene college and did an advanced diploma, and then I pursued my master's in higher education in order to become an educator. However, this is not the path that you need to take. There's multiple paths. I have students that have gotten into the program right after high school. They really knew what they wanted to do, and they came right after high school. You can join as a second career. So maybe you're in a career that you're not too happy with and you want to become a registered dental hygienist. You can pursue this program even as an adult or later in life. I have students that have done this as a second, even a third career, people that are in their 40s and 50s. And so it's not really limited to age. So if you are, just new and you're in high school and you're thinking about this career, you might want to shadow a dental office to see if this is something that you really want to do, and this is something that you can see yourself doing. You can volunteer in different places where dental hygienists work and see, what their typical day is like, and if that interests you. And if it does interest you, you can always shoot me an email or, follow my page and then direct message me. I will be happy to assist you in, the process of becoming a dental hygienist. Education is my passion, and any kind of new thing that's going on, I'd love to learn and share with you guys. Also, there is dental assisting programs that you can take that is much shorter. It's a year or less, depending on what kind of institution you're going to. And this is a good exposure to know if this is the right field for you. It's similar, but you're working with the dentist more than working independently. So being a dental assistant can also help you. You can also do like floating assisting or sterilization assistants. Now that there's new IPAC rules, or a lot of dental offices are hiring floating assistants and assistants to do just the sterilization. So that would be also a great opportunity to work in a dental office and see what that exposure is like. Okay, so dental hygiene in Ontario, there's many paths that can be taken. There's 18 colleges in total in Ontario, private and publicly funded. Currently in Ontario, there's no universities offering the dental hygiene program. That is very unfortunate, but it is being worked on and being spoken about quite a lot. There used to be a dental hygiene degree program offered at U of T, with the BSc-D in dental hygiene that ran from 1976 to 2001 and then got discontinued. And after that, since then, there hasn't been anything reintroduced. However, UBC and U of A, so University of British Columbia and University of Alberta, have bachelor's degree programs that you can do if you are interested in doing that. If you do have an advanced diploma or a diploma in dental hygiene from any institution, accredited institution, you can do degree completion program. So what that is it's a 2-year completion program. So once you've done the diploma, you can do university courses for about 2 years, part-time or full-time, depending on the school you're applying to. U of A, UBC, Manitoba, Dalhousie, they all offer this completion program. And then you can obtain your bachelor's degree afterwards as well. So there's a lot of options, a lot of room for flexibility in developing your skills. U of A only has the Masters of Dental Hygiene program currently, and they're the only university right now offering a graduate level courses in dental hygiene. So if you are in Alberta or you're planning to go there, then that's also a great option if you want to pursue more research-based dental hygiene, or thinking about going into education. There's also many options for employment. So this is not a limited list. There's definitely more than this. You can work in a general dental practice. You can work in a specialist practice like orthodontics, or even in oral surgery. You can work as an independent dental hygienist once you get self-initiated, which is a process that you have to go through in Ontario in order to work alone, separate from a dentist. You can start your own practice, your own dental hygiene practice. You can start a mobile practice. You can work from a basement as long as you have all the equipment and following the proper guidelines. You can work in education as an instructor, a part-time clinical instructor, or full-time. You can work in administration. You can work in public health. You can work in hospitals, although in Ontario it's quite limited. Currently, there's not too many hospitals that have a dental hygienist employed, but there are some that do. You can work corporately. You can work for dental supply companies. You can work for sales and promotion. You can work for social media. And then there's also the option of temping, which is, working on odd days in different dental offices and just on your time whenever you're available. So that has a lot of flexibility. So say you're a mom or single parent, or you have another job or another career, and this is a dual career, you can always do temping on the side, and you can make a little bit more money that way. And you can also see different offices and try different places. And also, this is not a limited list. So any new ideas that you guys have or anyone has, there's endless possibilities with this career. You can always think of a new way to use dental hygiene and oral health in order to promote it and also make a living out of it. So what I say is, if you can think it, you can do it. So if you have the idea, you can always make it happen. You just need to put it into action. So this is me in dental hygiene care pre-pandemic and during the pandemic. So you see quite a difference here. Pre-pandemic, a lot less PPE, and pandemic-wise, we have a lot more PPE going on. On the left here is my mom, and this is pre-pandemic where I was doing her dental cleaning for her. And during the pandemic, this was before the clients came in, so I just took a picture of all the PPE. And I'm wearing my loops, so you can the loops is something we can use to help to see better and also to help with your posture, but it's not something that is mandatory in the practice. Okay, so a dental hygiene case. This is a case before scaling and after scaling. So this is a client that came in for care for me. So one of the most satisfying things that I find as a dental hygienist is seeing the before and after pictures and seeing the client actually get motivated. So this client was actually really shocked that their teeth were this bad. All this here is calculus or tartar. And there was also a lot of subgingival calculus underneath the gums as well. And you can see here after the scaling, it's all gone and it's much more healthy. The tissues are healed and it's a little bit raw here because the picture was taken right away. But this is one of the most rewarding parts of the job. You can actually motivate people to take care of their oral health, and thus it actually helps systemically to help with other conditions they may have. So let's kind of go through this case here. So this is a client, male, 30 years of age. His last cleaning was over 5 years ago. His medications, he wasn't taking any medications, just some various vitamins that he was taking. And he has no systemic conditions. So very young, healthy male, no medications, no allergies. His chief concern was sensitive gums. And his treatment plan, what I created for him was to take x-rays first to kind of see if there's any cavities or anything going on. So the x-rays were prescribed by the dentist. So currently in Ontario, we need a dentist on site to prescribe x-rays. So if you are working as an independent dental hygienist, you would need a dentist on site to prescribe x-rays, or you can refer the client out in order to get x-rays. So, but in other provinces that this rule has been amended, so dental hygienists are able to prescribe x-rays in some provinces. So again, the regulations vary depending on where you are in Canada. So I took 4 bite wings, and the clinical diagnosis and the radiographic diagnosis indicated no cavities or no caries. There was generalized mild bone loss with localized area of moderate bone loss. So I thought that was really like shocking because, also the client thought it was shocking because he had no idea that he had bone loss at such a young age. So you can really inform the client about their oral health with images, x-rays, and you'll be very surprised with people that haven't gone to the dentist or dental hygienist in a really long time, that there's so much going on underneath their gums that they have no idea about. And they just think, I just put it off for so long, and they don't understand the link between oral health and systemic health. So in appointment 1, there was a complete exam done with half mouth scaling. So what I did was debriding quad 1 and quad 4. And I used 20% benzocaine topical anesthetic because he was really sensitive. And he managed without any local anesthetic, so we kind of just left it at the topical. We used Cowtron and hand scaling for appointment number 1. And we did a full thorough debridement of quad 1 and quad 4. Then the second appointment, we reassessed the areas for any remaining, calculus or anything like that. Everything was great. He was healing fine. And then we debrided quad 2 and quad 3, again with topical, and then followed up with selective polish for the areas where he had some mild staining. And then a 5% neutral sodium fluoride varnish was applied. He did have some recession in some areas, especially on the premolars and the canine areas. So we applied some fluoride varnish to help with the sensitivity there. So my favorite part of dental hygiene education is the oral hygiene education. So we reviewed his oral hygiene. He was not flossing. He was only brushing once a day and using a manual toothbrush. So I educated him about the difference between manual and electric toothbrush. He actually purchased an electric toothbrush, and now he's the biggest fan of electric toothbrush and uses it 1 to 2 times a day, hopefully 2 times now. And he did start flossing, but again, not so regularly. But it's a work in progress, and getting your clients to get motivated and keeping them on that goal is really important. So starting off with a small goal, like, 2 or 3 times a week for flossing or any interdental aids will really help keep that client motivated just when they see the results. So after he saw his before and after pictures, it was so motivated and so eager to come. And one of the reasons why he didn't go to the dentist actually was because of he didn't have insurance. So lack of insurance is one of the biggest barriers for people to not visit the dental hygienist or dental dentist to get cleanings and checkups, because they don't have the money for it. But once you kind of get them into the chair, it's your opportunity to show them the importance, and whether they have insurance or not, they'll be more motivated to come, at least, even if it's not for the recommended amount of time, at least once a year or twice a year. And that's a bigger thing than them not coming at all. So that's one of the biggest, rewarding factors of being a dental hygienist. So we put him on a 4-month recare appointment. So he comes in every 4 months for his cleaning and his checkup, and that will help maintain his gum health. So his client compliance increased drastically after just one visit. And this is something that's really important, because we can educate the public and we can educate people that do not have place any importance to their oral health, because they might have so many other barriers in their life, socioeconomic status, just low priority for dental health, and or just time, they're too busy. They have maybe I know a lot of people that have insurance and they just don't have the time to go to the dentist. So all of these factors are barriers, and we as dental healthcare professionals can help break those barriers. So dental hygiene tips for success. So this is again limited to if you are working in a dental office. If you are working in any other kind of setting, it's going to be a little bit different. But if you're working in a general dental office, my tips for success are to arrive to work at least 15 minutes early. So I personally arrive 30 minutes early because I like to have everything prepared and organized. So set up your operatory, prepare the trays that you can in advance. Make sure you have all the equipment that you need ready to go. You want to review all of your clients' charts for that day. Make sure you note any medical emergency things that have happened before, or any medical alerts. You want to make notes where needed. So, who needs an exam, who needs x-rays, who needs probing, who needs, local anesthetic, or if there's any kind of differences in their treatment plan, you want to make sure you note that down so it keeps you focused onto what you're doing for each client. You want to speak to the team about any pertinent information, so about the day. So, if there's any clients that require special attention, things about insurance, you want to speak to the whole team about all the things that are going to happen that day. And then you want to write and type out your notes as you go. So leaving your notes at the end of the day, it makes it a little bit more difficult to manage your time in your day. Sometimes it does happen, every day is not the same. You're going to run behind schedule, or, somebody might cancel, or, there's so many things that happen. So writing your notes as you go, or again, if there's a patient cancellation, you do your notes then if it's possible. And trying to stay organized will also help your day go smoother. So making sure everything is in order as much as you can will help make your day go smoother. Speaking to the receptionist and the dental assistant and the dentist about any kind of concerns that you have about the day beforehand is also helpful. And last but not least, having a positive attitude. So things always, happen in any workplace. There's people that can be rude to you, or you might have a really bad day, or somebody might say something, or you're really behind on your schedule. There's always things that can quote unquote ruin your day. But having a positive attitude and always keeping focus on what your goal for that day is will help you be successful in your endeavors and anything that you do. Okay, so that's actually it for what I had to say. I'm not sure if I spoke too fast, or if there's any other information that you guys want to talk about. You can definitely ask me any questions and I will be happy to answer.
Thank you so much, Harshini. So we do have a couple of questions. So question number 1 is, how do you deal with stress or manage work and life balance?
Okay, so that is a big question. It's something that I've had to work on quite extensively. I try to find pockets in my day where I do things that help relieve my stress. So personally, I do some meditation. Sometimes I just kind of sit there and do something that brings me enjoyment. So whatever it is, you can, if it's exercising, that really helps as well. If you do stretching, going out for walks really helps me as well. So even as busy as I am, I try my best to go out for a walk, at least even if it's 15 minutes in the day. Especially during COVID, we're always kind of stuck in our room or, in one area of our house, and going outside, stretching those legs, seeing outside, getting some vitamin D really helps. Find something that helps you relax, right? So it's different for everybody. For me, it's meditation. If you like to listen to certain types of music that helps you calm down, if you have a pet, a dog, taking them for a walk, things like that. I try to find at least 15 minutes to 30 minutes in every single day to do something that is not work related or anything that's going to cause me to become stressed out. In terms of work-life balance, it's something that I think we need to all integrate into our lives, as in, if your work is not, if you don't feel like your work is your work, then it'll become fun. So firstly, you need to kind of do something or pursue a career that you enjoy. If you enjoy what you're doing, it won't feel like work. So then the rest of the day is just extra for you, right? I know it sounds really cliche, but it's true. So if you can find some enjoyment in what you're doing, then that's going to help release your stress. But if you're working somewhere where you don't enjoy it, or you're studying something that you don't enjoy, you might want to reconsider what you're doing. And one of the hardest things I find for people is once they're really deep into their schooling. For example, you've done 3 years of a program or 2 years of a program, and you realize, hey, I don't want to do this anymore. They still continue to do the program. So as much as, time, you feel like time is wasted or your money is wasted or things like that, there's no such thing as wasted time. You've just learned that you spend a lot of time learning something, and you've learned that this isn't for you. And it's okay to restart. And that's something I learned the hard way. I was forced to restart many parts of my life. And it's something that's really hard to do. So I'm not going to say that it's easy to do, but if it's not causing you happiness and it's not getting you any fulfillment or enjoyment, then you need to reconsider, maybe I should change something in my practice or in my schooling, or maybe I should reconsider the whole thing. So that's something you guys need to think about on your own. And so hopefully that helps or answered your question.
Yes, that was great. So the next question is, what is something that you struggled with when pursuing to become a dental hygienist?
So first of all, I didn't even know what a dental hygienist was. So that's a funny story in its own. I didn't know what I wanted to do after my undergrad degree. So I was doing my undergrad degree in hopes of doing medicine or doing something in the medical field. But I soon realized, again, like in third year of university, that wasn't for me. So I was kind of in a, what you call a quarter life crisis. Didn't know what I wanted to do. I was pursuing different things, dipping my feet into different things. I took a year off of after undergrad to kind of think about what I wanted to do. So I would say the hardest thing about dental hygiene for me was actually choosing it. Once I applied for a bunch of things, I got early acceptance into dental hygiene, and I just thought, this might be a career that I would enjoy. I went into it almost blindsidedly. I didn't have any previous knowledge or background in anything to do with dental, and I ended up enjoying it. So that was kind of a fluke, but it worked out. Once I was in the program, one of the hardest things I find was managing like clients. So you have to find your own clients. So luckily I had a lot of friends and family that were in the area that definitely helped me out. But getting clients is one of the most difficult things, especially with my students now as well. There's certain criteria that you have to get some certain types of clients in order to pass your program. So that was definitely one of the hardest things. I was actually lucky enough. So in George Brown College, because I did an undergrad degree, there was certain courses that I could withdraw from. So I kind of deferred them because I didn't need to do them because I did courses in undergrad that were similar. So that lightened my load a lot. So especially if you're doing a full course load, plus trying to get clients, plus having to maybe have a job on the side, and if you have a family, it's very hard to manage the work-life balance. So you really have to focus on the things that are really important for that time. So getting clients ahead of time, making ads and doing all these things ahead of time really help. But I do understand the struggle. But that was my hardest thing.
So the next question is, how do you cope with patient expectations?
Okay, so this is not this is a very common problem, I would say. Patient expectations is you have to kind of tell the client or patient very early on, like in the first appointment, what is actually realistic. So if a patient comes in saying, all I want is whitening, I just want whitening, I want my teeth to be whiter, but they have gum disease and periodontal disease and a whole bunch of subgingival calculus and supragingival calculus, you don't want to give them false hope or false reality. So a lot of times people just say what the client wants or what the patient wants just so they can sit in the chair and not go somewhere else. But I find honesty plays a big role in keeping clients. So you need to tell them, directly what is actually possible and what's important, and then how you can help manage what they want. So of course, if the client wants whiter teeth, you can show them, tell them, explain to them how you can achieve that goal. But it's also important to talk about the underlying factors. So it's not important to get whiter teeth if you don't have any teeth left, right? So if you're going to lose all your teeth, then what's the point of whitening them? So it's kind of like you need to tell them straight, like ripping the Band-Aid off. So I find that it works best telling clients right away. And if they're not happy with that answer, they're free to go somewhere else. But at the end of the day, it's your it's your ethics, how you like to be a healthcare professional and what you believe in. And I believe in being honest and being truthful and helping the person with their oral health more than giving them false hope. So in terms of patient expectations, if it's something that is not realistic, definitely let them know, but also give them a little bit of a hope of how they can achieve that. But if it's something that they expect that's realistic, then definitely it's easy to do. But if it's unrealistic, then it's kind of tough, but we have to tell them the truth.
So the next question is there something you'd wish you had done differently when pursuing to become a dental hygienist?
I have to think about that one. I would have, now that I know kind of different paths, I would have maybe done a little bit of more volunteering and or shadowing before pursuing the career. It would have definitely helped me navigate all the things I didn't know. I don't regret now doing an undergrad degree first because I did get a lot of courses deferred and I had a lighter workload. However, I might have considered doing dental hygiene right after high school if I knew kind of what I wanted to do. So for all those students that know what you want to do and go for it, that's amazing. I find that actually very inspiring that you know what you want to do. But I would have done a little bit more research and a little bit more maybe shadowing, volunteering or working in a dental office before, because I had no idea I wanted to do that. And I only had some exposure to dental, working in a dental office after my first year of being a dental hygiene student. So I did it in the summer and then I kind of got a little bit more exposure. So that's something I would have done.
Okay, so that was great. Thank you. So for our last question, what's your favorite procedure to do?
Oh, I definitely love doing sealants. I don't do too many of them, but when I do get to do them, I love doing them. It's something that I didn't quite enjoy when I was doing schooling because it was mostly on, like, we did it maybe once or twice, but doing it in real children is really fun, especially if you have a help, like an assistant. Another procedure I like doing is polishing. I love seeing most patients or clients love the feeling of polishing. So doing something that clients enjoy, because nobody really likes to come to the dentist, to the dental hygienist. They're very afraid or nervous, or they don't like the procedure at all. So doing one thing that makes them happy is a really good feeling. Like they love to feel the, the teeth being all, smooth and clean and polished. So that's something that gives me happiness. Also, oral hygiene education, that's my favorite part. But sealants is probably the most fun thing.
So we actually do have one more question, if
Yeah.
that's okay. So, does hygiene feel repetitive, and what do you do to combat that?
Okay, so this is yeah. So hygiene, if you are working in a general dental practice, yes, I definitely have felt the repetitive nature of being a dental hygienist in a clinical setting. So I started off working 5 days a week, and then I actually went up to 6 days a week, and that burnt me out really, really fast, very, very in a very short time. And I was getting a little bit frustrated with, the kind of work that I was doing. So again, self-reflection and always thinking about what you want out of your career is really helpful. So I kind of moved out of that and I did two part-time jobs. So I did a couple of days in one office, another day, 2 days in another office. That gave it a little bit of variety, even though it's the same type of work that you're doing, the setting is different. So you can always consider doing part-time in multiple offices and getting full hours. So you can still work 40 hours a week or how many hours you want a week, and you can kind of split the days. So the mistake that I made was I actually worked 4 or 5 days in a row. And then I realized, I could have just asked for certain days or looked for offices for certain days. So, having a day in between in the week really, really helps. So especially like if you work Monday, Tuesday, you can have Wednesday off, work Thursday, Friday, maybe couple Saturdays a month. So having a schedule like that really helps with the burnout and with the repetitive nature. And if you work in different offices, if they do different procedures, like some offices do a lot more whitening and cosmetic procedures, and other offices work if you do perio or orthodontics. If you're kind of splitting up your day, that helps with burnout and with repetitiveness. Also, like, but if you're booking your own clients, like not booking the same thing over and over again. So if you're doing impressions or if you're doing sealants, things like that, you can put those in between in your schedule so you don't feel like you're doing the same thing every single day. And that's also part of the reason why I wanted to get into education. It's one of my passions. So I'm working clinically, but working in a different environment altogether, it makes it a little bit more easier in terms of like feeling like you're doing the same thing over and over again. In education, you're not doing the same thing over and over again. Again, if you want to work in public health, that's also an option. If you want to work in independent practice or even working in a dental hygiene practice, orthodontics, restorative programs are available if you want to do restorative. There's a lot of options. It's just up to you to kind of pursue it and make your own schedule. So try not to be too comfortable and too limited. Oftentimes I find dental hygienists, they get really comfortable where they're working and they don't want to leave it in fear of, losing their job or in fear of not finding another job. So kind of looking for better opportunities for yourself, and each person is different. So if you like to work in one office for 4 days a week and then have 3 days off, that's great. But if you're not that type of person, then you need to, consider different avenues. And I can talk more about this, but I'm pretty sure that's long enough.
So we do have a couple more questions come
Sure.
in. So for our next question is, what is something that you think people might take for granted when it comes to their dental health?
Definitely the understanding of the importance of dental health for the whole body, which is exactly why I started my dental hygiene page. Uh, for whatever reason, I don't know how it kind of came into the universe that the mouth is separate from the rest of our body. Even in billing and insurance, they for medical procedures and things like that, everything's covered by the government, but dental is somehow still privatized. There's a lack of awareness with bacteria and inflammation in the mouth that can go into the rest of the body and cause systemic problems and vice versa. So one of the things like diabetes, for example, is there's quite a few individuals that don't know that diabetes and gum disease or periodontitis is linked, and they're a bidirectional they're affected bidirectionally, which means that diabetes affects gum health and then gum health also affects diabetes. So this is something I told one of my clients, and they were shocked at this news. Like it was brand new news to them. and it's one of the motivating factors for them. So I told them, so he didn't want to come in at all. He came in because his wife came in, and he was like, I don't want to be here. And I started talking to him about, I'm like, I see that you have type 2 diabetes. Did you know that, having a dental cleaning can actually help manage your diabetes? And he said that no one's ever told him that. So this is one of the major things I find that is needed to change. And hopefully the more that we speak about this, the more awareness everyone will get.
So our next question is, what makes treatment planning between a patient and a dentist difficult?
A lot of things. A lot of things makes it difficult. So treatment planning on our end, as a dental hygienist or even a dentist, we try to do what's best for the client in terms of their health or in their oral health. So there's oftentimes people will come in with a lot of problems, a lot of cavities, a lot of dental issues, and there's a great treatment plan that is made by the dental professional, and we present it to the client. The first thing they will always ask is, how much is this going to cost? And is my insurance covering this? And insurance companies, especially in Ontario, only cover healthy people. So they only cover the basic necessities for people that are healthy. So this is something we need to also talk about and get awareness for, maybe even politically, to get this changed, because people that come into the office aren't always healthy and have great gums and teeth. So treatment planning, we can definitely do the best kind of care for treatment planning, but the patient has to also agree to that treatment planning and want to do that. So one, education is really important, explaining why you're doing what you're doing and why they need it, and how it's going to benefit them will help motivate them to do it. So even if they don't do all of it at once, they can, plan it out throughout the year. Maybe some parts are covered and some parts are not, and they can pursue with the treatment as needed. But one of the biggest barriers is definitely cost. Other than that, other barriers are people not even coming in the first place, right? So getting the person into the chair is one thing, but they just want to do the basic necessities. They don't need it. They don't think that getting their cavity fixed is a big deal unless the cavity is hurting them. So talking and educating people about all of these things and getting preventative care before these issues occur is really, really important, which is what I love about dental hygiene, is because we're just preventative care. So if you prevent all of these things from happening, then you won't need to spend so much money fixing it. So that's my take on it.
So our next question is, what's the toughest thing about being a hygienist?
Clinically, the toughest thing about being a hygienist is definitely the pain. And there's a lot of body, we're using repetitive skills, and your body will definitely take a toll if you're not exercising and keeping up with your exercise, and you have good posture. So if your posture is bad, over years you'll have back problems and wrist issues and things like that. So getting massages and going to physiotherapy will add up to your bills if you're not taking care of yourself and being healthy. So pain and body issues is one of the things. Other than that, depending again on your career choice or where you're working, it could be hours. One of the things that I faced is lack of hours or cutting down hours, especially during COVID time. A lot of patients are canceling, or they're not coming in at all because obviously for reasons for the pandemic. So having steady hours and getting a good place of employment is really a little bit challenging, especially on these times. Once you have it, it's good. So those are the two main things I would say.
And as for our hopefully last question this time around, what is the most common myth that you would say people believe in?
The most common myth, the first thing that top of my head is brushing harder is better. Brushing harder is not better. One of the common myths is also, unfortunately, that dentists and dental hygienists are just out to, say whatever they need to say to get more money. It's not true. It's something that is a kind of, because we're privatized and the government isn't funding our care and treating it as something we need for the health. People kind of think that it's, we're just saying something and it has no merit because we're just trying to get money. And that's not true because it doesn't really benefit us. But in terms of like oral hygiene, brushing harder is better is the first thing that comes to my mind. But yeah.
Okay, so that is all for questions. Thank you, Harishini, for taking the time to talk to us about your profession. It's truly appreciated, and I know I learned a lot from your presentation. Again, to our viewers, there will be no quiz posted for today's session. Again, and one last time to dental hygienist Harishini, I want to thank you again for today's session. Everyone, have a great day.
Thank you so much.